Thanks for staying with us here on The Pulse. Well, this afternoon, the NPP MP is turning the heat on the Driver and Vehicle Licensing Authority, accusing it of charging illegal fees. The DVLA for months have been charging what it called compliance fees against vehicle owners who did not adhere to legal and regulatory requirements. The DVLA listed nearly 50 items and charged 225 Ghana cedis for every alleged breach. But the NPR was telling you about the NPP MP, who is Wama Yakun, described the charges as illegal since it did not receive parliamentary approval. Let's listen to him. We'll be back with more.
Charges are imposed by Parliament, okay, not by any government agency on its whims and caprice, by regulation. So you would normally have made your fees, taking it through government for approval, and then it will be laid before Parliament. Parliament will have to approve it before you go ahead and charge. But here's the case: the DVLA had gone ahead to charge people for either sport fines, amongst others, without recourse to Parliament. And that is an affront to the law. And these are areas we are raising because it is becoming one too many. The government thinks that a lot of its decisions that require parliamentary approval now never seeks to come to Parliament with it. Is it because they want to bring the image and reputation of Parliament into disrepute? Or is just a disregard because they have absolute majority?
Well, thankfully, we've been joined on the phone lines now by Stephen Atu, his Director of Corporate Affairs at DVLA, and he is about to respond to some of the key concerns being raised by the NPP MP for Ifia, Isaac Wama Yakun. Thank you so much for your time here on The Pulse. Now, let's start with the basics. The argument in the air is that there's a difference between charges and fines. What you were charging, was it spot fines or was it a charge?
DVLA was not charging spot fines. Good afternoon to your viewers.
Okay. We
appreciate the fact that spot fines, as spelled out under the Road and Road Traffic Regulations 2012 Act, or LI 2180, makes a clear distinction on what a fine is. And we know that falls directly under the Ghana Police Service. They do the spot fines. What DVLA is doing is to enforce the fees and charges as approved by Parliament. The Honourable Member is not fair to DVLA by suggesting that we are making charges which have not been approved by Parliament. I have with me this document titled Fees and Charges, into brackets, Miscellaneous Provisions, bracket closed, Regulations 2023. That is fees and charges. And you know that the Finance Ministry is charged with the responsibility of laying before Parliament the fees and charges of institutions that have the right or that have been mandated to charge such fees. And so the Ministry of Transport collated the agencies under it, for instance, the Ghana Aviation Authority, the Maritime Authority, and all of those that are qualified to charge fees. They collect the proposed fees and then pass it through the Ministry of Finance, which is laid before Parliament, and then approval given. And this was approved. In fact, this reviewed charges was approved in 2023. Meanwhile, it had been in existence long before now. In fact, you see, when you pick the regulations, which is the Regulations 2180, okay, under the Regulation 158, you see clearly what we call power to inspect, impound, and prohibit the use of motor vehicles. That falls within DVLA. In fact, when you take the very first provision, it says an examiner, an authorized vehicle inspector appointed by the licensing authority, which is the DVLA. And that is what they are doing. In fact, as it stands, your vehicle is expected to be in a particular state. And it is on DVLA to ensure that every vehicle that is put on the road is within that particular space. So you are supposed to have a vehicle not tinted beyond a certain level. You are expected to carry the requisite documents on the road to drive. In fact, which officer can really inspect vehicle documentation better than DVLA?
So
It's only DVLA
clarify
officials.
for us, compliance fees which you were charging, didn't you need parliamentary approval to charge
And I'm just
those
telling you
fees?
that I just told you that these compliance fees were actually approved by Parliament under the Fees and Charges Act, Regulation 2481. In fact, look at it here, stated clearly, this amount 225, when you open the document on page 120, you see clearly non-compliance / unauthorized modification. So if you have a vehicle that you've modified that has not been authorized by DVLA, you are supposed, and the fine there is 225 Ghana cedi. It's stated out in the regulation directly. So the impression being created that DVLA began enforcing and making demands for payment for non-compliance, figures that have not been approved by Parliament, is not true. That's the point I want to emphasize. Regulation 2481 spells out these figures clearly. So that assertion is really not true. Now, what engagement with our compliance team means is that, you see, there are a lot of people who have defective documentation on our roads, but who you cannot get the opportunity to get them to pay unless they visit DVLA office. So what our compliance team began doing was that they go out there, determine or inspect vehicles, and when they find those instances which do not comply with the regulations, they block your car in the system. Now, from the understanding we are having, some individuals rather proposes that, oh, let's pay off so that I don't get blocked, because when you go back to DVLA to rectify the situation, you'll be compelled to pay the 225 depending, and each offense is 225. So they will itemize them and then give you the bill to pay. Some customers opt to pay, or some clients opt to pay instantly, and people misconstrue that to mean a spot fine. Otherwise, you have a choice of allowing your vehicle to be suspended or blocked in the system when you go to DVLA, and they tell you immediately to go and rectify the situation. So before you come to DVLA, you must ensure that all the defects that you've detected have been fixed. And then when you come, you make the payment, and then they unblock you and renew your roadworthiness for you. So that is exactly the exercise that has been undertaken on our roads. And
so if that's the case, why then did you suspend the compliance charges?
Yes. So you see, even from the first question you asked, was it a spot fine or a compliance charge? You see, that also does not take away the fact that when you come to DVLA, for instance, to renew your roadworthy, and we find out today that your roadworthy had expired 4-5 months ago, there's a delinquency charge that you pay, which is charged on you on a monthly basis. You have to clear that before the vehicle gets the roadworthy renewed. So that confusion as to whether it is even a fine or a charge, which we know very well that we are not imposing spot fines on the people. It is important we have conversations like this. Again, you know, for instance, if vehicle comes from home, let's say BMW, the vehicle is tinted from the manufacturer. This, our laws as we have currently, makes specific provisions. When you have a tint beyond a certain level, you are required to be charged to pay, and then you go and rectify it. My sister, under such a circumstance, a brand new vehicle you can see, which comes with that, but people are adhering strictly to the law. We want to see where there's a possibility of making amendments to accommodate some of these instances. We'll use the opportunity to educate the public a little more better. Then we'll reintroduce them on the road after we are sure that we have done enough public sensitization. And then the compliance charges would be enforced rigorously.
So how long would this public sensitization be for before you reintroduce the compliance charges enforcement?
We intend that we'll use up between now and the end of the year to intensify our public education. And then we believe that after the turn of the year, we would have had enough public engagement. And then, It's the law. You know, don't forget the law. They always tell you ignorance of the law is no excuse. We are applying a human fees. In fact, so long as, you know, even the MP didn't know that this fees and charges was approved. But again, that is the law. But we are applying a human face to say, look, we think that we still need to engage a little more. From next year, we'll fully enforce this.
Thank you so much, Stephen Otter. He is Director of Corporate Affairs for DVLA. Away from that, the Minerals Development Fund says it is initiating measures to mitigate the health impact of illegal mining on affected communities. The dangers of heavy metals on the health of persons living in mining communities are being manifested in health facilities. Administrator of the fund, Dr. Hannah Louisa Bisiu-Kote, says government is adopting a holistic approach to developing mining communities. Now, Nana Yaojima has more in this report because he was at a breast screening exercise hosted by the Middle Belt Office of the Minerals Development Fund. He filed this report.
The dangers of illegal mining on the health of persons in mining communities are widely being manifested. Research has shown children in these communities are being born with deformities. The unregulated use of heavy metals like mercury and cyanide in Galamsey is among causes of such health conditions. Researcher at KNUST, Professor Paul Pokusampene, explains the smallest quantity of such heavy metals could negatively affect the human body.
But the child, when he ingests, is absorbed, this level of absorption is 50%. So if you took maybe fufu, which has these heavy metals contaminating the components that made the water that was made used to make the fufu, the child will absorb 50%, assuming that is 100 that was there. He absorbing 50 out of the 100.
In protecting the communities, the Minerals Development Fund is rolling out a plan to detect health conditions and support communities in dealing with them. The first phase of the health support includes screening for early detection of some cancer cases in mining communities. Administrator of the fund, Hannah Louisa Bisiu-Kote, explains intentions to roll out a holistic approach to health challenges in the area.
Because of the contamination of our water bodies and other stuff, cancer and other sicknesses or other infirmities, if you want to put it, have actually, has been afflicting our people living in the mining communities. The Mineral Development Fund is approaching the community development in a holistic manner, where if you are building a cheap compound, you are not building it for sick people. You want to build a cheap compound for prophylactic purposes, preventive. If you have to cure sometime, that's fine. But I want to make sure that our people are educated in terms of their health needs, and also things like breast cancer awareness. Yes, as we move forward, we move into cervical cancer screening and support for women.
Meanwhile, as part of the MDF's corporate social responsibility, a breast screening exercise has been organized for the public. Together with SACS Clinic, hundreds of people were screened. For Joy News, Nana Yaojima, Kumasi.
Well, joining me in the studio this afternoon is Dr. John Baptist. Now, he's a German-based Ghanaian applied research scientist with postdoctoral experience, an AI engineer and founder of the environmental NGO Climate Frontier Advocacy. We appreciate your time here on The Pulse. We've just been hearing from government there are different strategies to deal with illegal mining. From where you sit as a researcher, do you think the various tactics we're employing is actually going to yield us the results that we desire?
Thank you, Faustina, for having me, and good evening to your viewers. As you will know, the phenomenon of Galamsey is a very serious environmental matter, and I'm one of those who has been keenly focusing on this or following this Galamsey menace. And we've all read about the impacts of this illegal small-scale mining. And what I would say is that I've had the opportunity to be part of the CSOs who were invited to meet the president on the 3rd of October. And although I had my reservations about how we are seriously fighting this environmental canker, I've come to realize that the current government is putting in a lot of effort to be able to clear up the mess. And so I'll give the current government a commendation for putting in measures to be able to more or less contain the problem. Because we have to, first of all, contain the problem in order to find sustainable solutions. But having seen what they have done, they've done a lot of arrests. Over 1,400 arrests were made, fines were destroyed, and the Attorney General at that meeting with the CSOs talked about reviewing the Minerals and Mining Act, Act 703, that was passed in 2006. All these measures look good, as I said from the beginning, commending the government, but as a civil society group, we feel that what is happening now, we need much more efforts because the problem is bigger than what we are seeing.
Did you attend that meeting with CSOs?
Yes, I personally attended that meeting on the 3rd of October, and that was where presentations were made. And I realized that the government is really putting in a lot of effort to do this. But we believe that we have seen this happening for a very long time. Illegal mining has been with us for a very long time. But we are not talking about the scale at which it is happening now. It is unsustainable. So that is why at my organization, Climate Frontier Advocacy, we strongly believe that if care is not taken, Ghana is really on a time bomb. And so the measures now are looking good, but we feel that that is not enough. For example, the government is trying to do the things that we used to see. I mean, forming task forces, trying to make some arrests. But before we realize, we don't see much being done. So from our side, we want the government to employ a stepwise approach. And one of the important steps that actually we want government to take, and also at the CSO's meeting with the president, I did not have the opportunity to ask the president directly, but those who were able to ask made a strong point, which we strongly believe, that the president should declare a targeted state of emergency, because that will give us the opportunity to concentrate our national resources to be able to confront this environmental canker. So for now, I think that before we can really make a great progress, we want to see government thinking about declaring a targeted state of emergency. For us, we think that that will help us to be able to do this. But one other thing I would like to add is that it appears when it comes to environmental matters, we don't take that very seriously. And that is where it is not a Ghana problem. It is not a Ghana problem. It is a problem that is known globally, that many people feel that what is happening to our environment is not much an issue. But that is not the case, because our very life is actually founded on the ecosystem services that we derive from the natural environment. So if we allow this Galamsey to more or less incapacitate our forest reserves, we were told that 44 out of 288 forest reserves were affected, and 9 of them were no-go area because they were taken by illegal mining. And what we heard from NIMOS, the Anti-Illegal Mining Operations Secretariat, they said they've been able to reclaim those 9 no-go areas, which we think is very positive. But the government should have a stepwise approach. And we are also calling for a national dialogue on Galamsey. That is one thing that we at CFA felt that this has not been done. When this government came into power, they organized a national dialogue on the economy, and after which they organized a national dialogue on education. And we were of the opinion that because we are faced with this gargantuan environmental problem, the government should have been proactive enough to call a national dialogue. Ghanaians, how do you want us to be able to solve this problem? And I think that if it is not too late, and I think that the government has already started to see the need to invite CSOs so that we'll be able to discuss this. And we were told that it will not be a 9-day wonder. We'll be invited, but I think much more should be done.
Thank you so much, Doc. We appreciate your time here on The Pulse. Away from that, a free breast screening exercise was held in Techima just to help women and girls just know their status currently as we celebrate the month of October, the month for breast cancer awareness. There's more in the following report.
Right here at the Techiman RC Basic School, a collaborative effort between the Holy Family Hospital and the Cancer Support Network Foundation saw more than 120 people step up for a free health checkup. A powerful show of community engagement, but the initial results are a stark warning bell. Of those screened, abnormalities were found in some 44 individuals. That's more than 1 in 3. 2 cases were serious enough to require immediate biopsies. This number underscores a critical gap between community need and routine medical care. Board Secretary of the Cancer Support Network Foundation, Gabriel Asumin, underscores the need for the public to take breast cancer screenings seriously.
Through my personal involvement with Cancer Support Network, we find that there are some women who are walking through our markets with very bad cases of breast cancer, travel to the liver, to the bones in the back, to the brain, and that makes the treatment much more difficult. So we are hoping that through various organizations doing consistent education, we can detect breast cancer early so that we can get people the treatment they need so that they can go about their lives.
He further shared a passionate plea. If a lump is found, your next step must be a hospital, not just a prayer camp. Faith, according to him, is vital, but it must be complemented by science.
As a pastor and as a doctor, I pray for my patients. So we won't discount the importance of your faith in your healing process, but the most interesting thing that every patient, every person in Ghana will have to ask themselves is, of all the thousands of doctors that are in Ghana, when any one of them gets sick, will they go to the hospital or will they go to a prayer camp? When the pastors, myself included, get sick, do we go to the hospital or do we stay at home and pray? And if we go to the hospital when we are sick, then the church members need to pay attention.
This urgent call for medical follow-up is echoed loudly by the doctors here who are on the front lines. They see the devastating consequences of late reporting every single day. Dr. Kingsley Bosompem is a general surgeon here at the Holy Family Hospital.
Especially in the resource-limited communities, we record about 70 to 80%. In other words, 7 to about 8 out of 10 patients will come with what we call locally advanced or metastatic. Now, early breast cancer is curable. Locally advanced is quite difficult to treat, and then when it's in metastatic, it's no longer treatable. So the main challenge here is that they come in very late, 7 out of 10, which is not a very good sign.
54 new cases in just 6 months, a stark number that highlights the critical need for prevention. This is why the message from experts is so consistent and clear.
We started our clinic, breast care clinic, not too long ago, and the cases are rising. For the first half of the year, 2025, we have been able to, we've diagnosed 54 cases of breast cancer. Compared with last year, we are recording high numbers of cases. So we need to put the data together and can make it.
So the message from Techiman is one of urgency wrapped in hope. While the numbers are rising, the power to change the outcome lies in early detection. The success of this screening proves that when services are brought to the community, people will participate. Anna Sabit, Joy News, Techiman.
So watching The Pulse, stay with us. We'll be back to tell you all about the HR conference shortly here on The Pulse.